Good morning, dear students. Today's class is regarding sleep and EEG. Now we'll see what is sleep. This is a very important part of life. As you know, sleep is a natural periodic state of rest for a mind and a body with a closed eyes, characterized by a partial or a complete loss of a consciousness. Okay. So loss of consciousness leads to decreased response to external stimuli and decreased body movements. The depth of a sleep is not constant throughout the sleeping period. As you know, it's a well experienced topic, right? And it varies in different stages of a sleep. So what is the sleep requirement for a different age group individuals? The sleep requirement is not a constant. However, average sleep requirement per day at different age groups is for a newborn infants. Means within a month it is around 18 to 20 hours of a sleep. Growing children, that is 12 to 14 hours sleep. For adults 7 to 9 hours. Old person it is 5 to 7 hours. So how much is your sleep requirement? It is around 7 to 9 hours. So what are the physiological changes that occurs during sleep? During sleep, most of the body functions are reduced to basal level. The following are the important changes in the body during sleep. So what are the important changes you will see during sleep is the plasma volume. What happens to the plasma volume? Plasma volume decreases by about 10% during sleep. Then second is in cardiovascular system, what are the changes you see during a sleep? Heart rate. For a heart rate during sleep, it reduces. Heart rate will reduce. It varies between 45 to 60 beats per minute. Next is the blood pressure. Systolic blood pressure falls to about 90 to 110 mmHg. The lowest level is reached about 4th hour of the sleep and remains at this level till the short time before waking up. Then the pressure commences to rise. After a 4th hour, the BP will remain low until the 5 minutes, few short time before waking up, and the pressure remains rise with a normal level. If the sleep is disturbed by exciting dreams, the pressure may elevate it up to 130 mmHg. That is regarding the cardiovascular changes of a heart rate and a BP. Then coming to the respiratory system. The rate of respiration are decreased, again it is decreased. Respiration becomes irregular, that is Cheyne-Stokes type of a periodic breathing may develop. By now you know what is Cheyne-Stokes breathing, right? So then the respiratory rate will be decreased with a pattern of Cheyne-Stokes breathing. Then gastrointestinal changes, that is salivary secretion decreases during sleep. Salivary secretion decreases during sleep. Gastric secretion is not altered or may be increased slightly. Then contraction of an empty stomach is more decreased during sleep. Next, excretory function. In the excretory system, the formation of the urine decreases and specific gravity of the urine increases. Okay. So what happens? The formation will be decreased, the specific gravity will be increased. Coming to the sweat secretion. The sweat secretion increases during sleep. Next, lacrimal secretion. The lacrimal secretion is nothing but the secretion Lacrimal glands, where the lacrimal glands present in the eyes, right? So the lacrimal secretion decreases during sleep. The tone of the muscle, the tone of all the muscles of the body except the ocular muscles decreases very much during sleep. Then it is also called as a sleep paralysis because of a decreased tone during the sleep. It is called as a sleep paralysis. Next, reflexes. Certain reflexes, particularly the knee jerk, are abolished. Babinski signs become positive. When we were telling regarding the UMN lesion, the physiological positive sign of a Babinski sign you will see in newborns, in comatose patient, and during sleep, right? So these are examples for that. Babinski sign become positive during sleep. The threshold for most of the reflexes increases. The pupils are constricted, light reflex is detailed, eyeballs will move up and down. Coming to the brain changes. In the brain is not active during sleep. There is a characteristic cycle of a brain wave activity during the sleep with irregular intervals of dreams. The electrical activity in the brain varies with the stages of a sleep. These are the systemic changes, different system changes during the sleep. Then coming to the types of a sleep. Sleep is of two types, rapid REM sleep, NREM sleep. What is REM sleep? It is a rapid eye movement sleep or REM sleep. Non-rapid eye movement sleep or NREM sleep or non-REM sleep. The rapid eye movement sleep is REM sleep. It is a type of a sleep associated with the rapid conjugate movements of the eyeballs, which occurs frequently. Though the eyeballs will move, the sleep is deep. So it is called as a paradoxical sleep. It occupies about 20 to 30% of the sleeping period. Functionally, REM sleep is very important because it plays important role in consolidation of a memory. Dreams occur during this REM sleep. Coming to the second one, NREM sleep or a non-rapid eye movement sleep or non-REM sleep. It is the type of a sleep without the movement of a eyeball. It is called as a slow wave sleep. Dreams does not occur in this type of a sleep and it occupies about 70 to 80% of a total sleeping period. Non-REM sleep is followed by the REM sleep. It is a cycle. First REM sleep, then NREM sleep. Then coming to the stages of a sleep under EEG pattern, rapid eye movement sleep. During REM sleep, EEG, that is electroencephalogram, shows a irregular waves with high frequency and a low amplitude. These waves are desynchronized waves. So in NREM sleep, it is divided again into 4 stages based on the EEG pattern. During the state of wakefulness, while lying down with the closed eyes, relaxed mind, the alpha waves of EEG appear. When the person proceeds to drowsy state, the alpha wave will diminish. Means when the person is relaxed mind, just lying down with a closed eyes, you will get an alpha wave where it is showing that he is awake. When the person proceeds for a drowsy state, the alpha wave will diminish. The stage 1 is stage 1 of drowsiness. Alpha waves will diminish and abolished. EEG shows only low voltage fluctuations and infrequent delta waves. In the stage 2 of a light sleep, it is characterized by a spindle burst at a frequency of 14 per second, superimposed by a low voltage delta waves. Then it's coming to the stage 3. In stage 3, it's a medium sleep. During this stage, the spindle burst disappears. Frequency of the delta wave decreases to 1 or 2 per second. And amplitude increases to about 100 microvolts. In the stage 4 of a deep sleep, delta waves become more prominent with a low frequency and a high amplitude. These are the 4 stages of a NREM sleep. Coming to the differences between REM and NREM sleep. This is a very important where you will get it for a 3-mark question. Okay. In the 3 marks, they may be asked for differences between NREM and REM sleep. So, what are the differences between these two? In rapid eye movement, that is REM, is present in, as the name indicates, in a REM sleep. In a non-REM sleep, it is absent. The dreams are present in the REM sleep, whereas in non-REM sleep, there is no dreams. Muscle twitching is present in REM sleep, it is absent in non-REM sleep. Heart rate is fluctuating here, here it is a stable. The blood pressure is fluctuating again in the REM sleep, whereas in a non-REM sleep, it is stable. The respiratory system, respiration rate and the rhythm will be fluctuating here. Here it is stable. The body temperature is again fluctuating, and in the non-REM sleep it is stable. The neurotransmitter the released in the REM sleep is noradrenaline. In the non-REM sleep it is a serotonin. So there is a differences between REM and a non-REM sleep. Coming to the mechanism. What is the mechanism of a sleep? The sleep occurs due to activity of some sleep-inducing centers in the brain. The stimulation of these centers induces sleep. The damage to the centers results in the sleeplessness or persistent wakefulness called insomnia. But which are the sleep centers? The sleep centers, the complex pathways between the reticular formation of brainstem and diencephalon and the cerebral cortex are involved in the onset and maintenance of a sleep. However, 2 centers which induce sleep are located in the brainstem, that is Raphe Nucleus and Locus Ceruleus of Pons. The recently many more areas that induce sleep are identified in the brain of the animals. Inhibition of a AR area, that is ascending reticular activating system, also results in a sleep because reticular activating system involves in the alertness, right? When you inhibit that reticular activating system, you will get a sleep. Coming to the first center, that is a Raphe Nucleus. Raphe Nucleus is situated in the lower pons and the medulla. Activation of this nucleus results in a non-REM sleep. It is due to the release of a serotonin by the nerve fibers arising from this nucleus. Serotonin induces a non-REM type of a sleep. Then Locus Ceruleus of Pons. The activation of this center produces a REM sleep. Noradrenaline released by the nerve fibers arising from this induces a REM sleep. Third is inhibition of the ARAS is responsible for a wakefulness because of its afferent and efferent connection with the cerebral cortex. Inhibition of ARAS induces a sleep. The lesion in ARAS may lead to the permanent somnolence, that is coma. This regarding the sleep. So what all you learned? The definition of a sleep, then the changes, systemic changes that occurs in the serious RS, GIT, what happens during the sleep, then types of a sleep, REM sleep and a non-REM sleep, then differences between the REM and non-REM sleep, and mechanism of the sleep are the centers in the brain where they are located, sleep centers, and the neurotransmitters, what it does in the sleep. Now coming to the applied aspect. The applied aspect of this is the many sleep disorders. This each one is very important. It may be asked for a 5 marks question or a part of a main question. First one is insomnia. Insomnia is a inability to sleep or abnormal wakefulness. It is the most common sleep disorder. It occurs due to systemic illness or a mental condition such as psychiatric problems, alcoholic addiction, and drug addiction. Insomnia is for the inability to sleep due to the systemic illness or mental illness such as psychiatric illness, alcoholic addiction, and drug addiction. Next is hypersomnia. What is hypersomnia? It's the excess sleep or excess need to sleep. It occurs due to the lesion in the floor of the third ventricle, brain tumors, encephalitis, chronic bronchitis, and diseases of the muscles. Hypersomnia also occurs in the endocrine disorders such as myxedema and diabetic insipidus. Next is narcolepsy or catalepsy. Narcolepsy is a sudden attack of uncontrollable sleep. Cataplexy is a sudden outburst of emotion. Both the diseases are due to the hypothalamic lesion. Next is sleep apnea syndrome. It's a temporary stoppage of breathing repeatedly during sleep. Sleep apnea syndrome is a disorder that involves the fluctuation in the rate and force of respiration during REM sleep with a short apneic episodes. Apnea is due to decreased stimulation of our respiratory centers, arrest of diaphragmatic movements, airway obstruction, or the combination of all these factors is apnea. When a breathing stop results in hypercapnia and hypoxia stimulate the respiration, because of which you will get a Cheyne-Stokes breathing type of a periodic breathing. The sleep apnea syndrome occurs in obesity, myxedema, enlargement of tonsils, lesions in the brainstem. Common features of this syndrome are loud snoring, restlessness, movements, nocturnal insomnia, daytime sleepiness, morning headache, and fatigue. In severe condition, it may occur hypertension, right heart failure, and a stroke also can occur in this sleep apnea syndrome. Then coming to the nightmare. What is this nightmare? The word which you use commonly. You sometimes you will be using that exam was like a nightmare, right? So what is exactly the meaning of a nightmare? Nightmare is a condition during a sleep that is characterized by a sense of extreme uneasiness or discomfort or by a frightful dreams. Discomfort is felt as some heavy weight on the stomach or chest, as uncontrolled movement of the body. After a period of extreme anxiety, the subject wakes up with a troubled state of mind. It occurs mostly during a REM sleep. The nightmare occurs due to improper food intake or digestive disorder or nervous disorder. It also occurs during a drug withdrawal or alcohol withdrawal. This is a nightmare. Okay, so you learned the 4 or 5 instances of a sleep, disorders of the sleep, which can be asked for a 3-mark question. Now we'll move on to, after the sleep, it is a EEG. Now we'll move on to EEG. What is this EEG? It's a electroencephalography. It's a study of electrical activities of the brain. The electroencephalogram is a graphical recording of electrical activities of the brain. The electrical activity of the brain is complicated when compared to that of the single nerve fiber or a neuron. Okay. Then it is due to the involvement of a large number of neurons and the synapses in the brain. You get a complicated waves in the EEG. The German psychiatrist Hans Berger was the first one to analyze the EEG waves systematically, and hence the EEG waves is also referred to as the Berger waves. Okay. So Berger waves are EEG waves. In the exams, they can ask for 3 marks. Seeing this, taking this name also, Berger waves. What is the significance of this EEG? Electroencephalogram is useful in the diagnosis of a neurological disorder and sleep disorders. EEG pattern is altered in the following neurological disorders: epilepsy, which occurs due to excessive discharge of impulses from the cerebral cortex; disorders of midbrain affecting ascending reticular activating system; subdural hematoma, during which there is a collection of a blood in the subdural space over the cerebral cortex. These are all the diseases which can be diagnosed by this EEG. What is the method of recording? EEG, electroencephalograph, is an instrument used to record the EEG. The electrodes called as scalp electrodes from the instrument are placed over the unopened skull or over the brain after opening the skull by piercing the brain. So what are the waves you get in the EEG? First is alpha wave or alpha rhythm. It consisting of a rhythmical wave which appear at the frequency of 8 to 12 waves per second with the amplitude of 50 microvolts. The alpha waves are synchronized waves. The alpha rhythm is obtained in inattentive brain or a mind in a drowsiness or a light sleep or narcosis with a closed eyes. It is abolished by visual stimuli or any other type of a stimuli or mental effort. So it is diminished when eyes are open. This alpha wave or alpha rhythm. Waves of alpha rhythm are most marked in the parieto-occipital area. So while recording, you should keep electrodes in the parieto-occipital area to record the alpha rhythm. Sometimes these waves appear in other areas also. The major ones are parieto-occipital area. Next, alpha black. What is this alpha black? This will be asked for 3 marks and in a Viva questions. And you have a charts also in the clinical practicals regarding the alpha block. So what is alpha black? Alpha black is the replacement of synchronized alpha waves in EEG by desynchronized and low voltage waves when the eyes are open. The synchronized wave do not have a specific frequency. It occurs due to any form of sensory stimulation or mental concentration, such as solving arithmetic problems. Desynchronization is a common term used for replacement of a regular alpha waves with the irregular low voltage waves. It is due to the loss of synchronized activity in the neural elements that are responsible for a regular wave pattern. This alpha block. Next, beta rhythm or beta wave. It includes the high frequency waves of 15 to 60 per second, but the amplitude is 5 to 10 microvolts. The alpha rhythm is around 50 volts, right? So beta waves are desynchronized waves. The beta rhythm is recorded during a mental activity or the mental tension or arousal state. It is not affected by opening of the eyes, but the alpha wave will be diminished when the eyes are open. During a higher mental activity, peak performance state like consciousness activity and the problem solving and fear, very high frequency wave of 30 to 100 per second will appear. That is beta rhythm. Some controversy existing in names such as the such waves. Often very high frequency waves are called as the gamma rhythm. However, many scientists consider these waves are a beta rhythm also. Next, coming to the delta waves or delta rhythm. This includes the wave with a low frequency and a high amplitude. So these waves have a frequency of 1 to 5 per second. 1 to 5 per second. Then the amplitude is 20 to 200 microvolts. It is very common in early childhood during waking hours. In adults appear mostly during a deep sleep. The presence of delta waves in adults during conditions other than the sleep indicates pathological process in the brain like epilepsy, increased intracranial pressure, mental deficiency or depression. These waves are not affected by opening of our eyes. Next, coming to the theta waves. Theta waves are obtained generally in children below 5 years of age. These waves are low frequency and a low voltage waves. The frequency of theta waves is 4 to 8 per second and the amplitude is about 10 microvolts. Coming to next, this is regarding the EEG waves. EEG, okay, EEG and EEG waves. Now, what we learned is the definition of a EEG, how it is being measured, and what are the waves: alpha, beta, delta, and theta waves with the frequency and voltages here learned. This regarding the sleep and the EEG. Now we move on to the MCQs of our related topic. Okay, we'll start. You have to answer now. Just now only you have heard, right? EEG wave recording the awake person with wandering and eye closed is alpha wave, beta wave, theta wave, and delta wave. Which one is recorded? The answer is A. That is alpha wave. That is the awake person with wandering and eyes closed. EEG wave recorded an alert person doing a mathematical calculation or arithmetic calculation is alpha wave, beta wave, theta and delta wave. Answer is beta wave. Dreaming is common during that type of a sleep. REM sleep, NREM sleep, both REM and NREM sleep, none of the above. Which is the answer here? It's a REM sleep. The following are the features of the REM sleep except rapid eye movement of the eyeball. Is it present or no? It's present, right? It is associated with the dreaming. Yes. The muscle tone is grossly reduced. Correct. Theta wave pattern EEG is recorded. This is wrong. Answer D is not present in the REM sleep. The disorder of a speech is called as aphasia, anosmia, amnesia, agusia. Answer is aphasia. Anosmia is loss of smell. Amnesia is loss of memory. Agusia is loss of taste. So, conditioned learning is an example of what? Associative learning, non-associative learning, short-term memory or long-term memory. What is the answer? Answer is A. Associative learning. Next, the following are the functions of hypothalamus except the fluid and water balance, temperature regulation, relay center for different sensation, control of feeding and satiety. So, what is the answer? The relay center for different sensation. Which is the center for that? Is thalamus, right? Loss of memory is termed as amnesia, anosmia, agusia, aphasia. So, answer is amnesia. The part of thalamus which form the component of visual pathway is LGB, MGB, ventroposterior nucleus, anterior nucleus. Answer is visual pathway. As I told on that day, it is lateral geniculate body, that is LGB is for visual, MGB is for auditory pathway. The part of thalamus which forms a component of auditory pathway is LGB, MGB, ventroposterior lateral nucleus, thalamic anterior nucleus. Answer is B. Medial geniculate body. The seat of emotions in the brain is prefrontal cortex, limbic system, corpus callosum, reticular formation. So it is the answer here. The seat of emotions is for limbic system. The lesions in the Wernicke's area results in global aphasia, non-fluent aphasia, conduction aphasia, failure of comprehension of spoken and written words. Answer is D. Brown-Sequard syndrome. The pain loss in the opposite side of the lesion. The fine touch is lost in the opposite side of a lesion. UMN paralysis in the opposite side of a lesion. LMN paralysis in the opposite side of a lesion. Answer is A. Pain loss in the opposite side of a lesion. The compared to plasma, CSF is higher concentration in calcium, sodium, chloride, glucose. Answer is C. Chloride. REM sleep is characterized by sleep spindles, alpha waves, delta waves, and beta waves. The answer is D. Beta waves. REM sleep is during REM sleep, the EEG records of beta waves. The Broca's area is concerned with the word formation, comprehension, repetition, and reading. So answer is what? Answer is A. Word formation. The thalamic nucleus involved in the Papez circuit is pulvinar, interlaminar nucleus, ventroposterior lateral nucleus, anterior nucleus of a thalamus. Answer is anterior nucleus of a thalamus. The first reflex response to appear in humans during the stage of recovery after spinal shock is tympanic reflex, withdrawal reflex, neck-writing reflex, labyrinthine reflex. So answer is B. Withdrawal reflex is the one which will appear after a recovery from a spinal shock. Thus, can be induced by electrical stimulation of the posterior hypothalamus, osmotic stimulation of supraoptic nucleus, lesion in the paraventricular nucleus, neural lesion in the preoptic nucleus. Answer is osmotic stimulation of the supraoptic nucleus. The inhibitory neurotransmitter in CNS neurons is glutamate, aspartate, GABA, acetylcholine. The answer is GABA. So this regarding the MCQs and the topic sleep and EEG. This MCQs because you have a PCT right coming in the next week. So that time I think we may give a MCQs instead of writing a answers for CNS. Because of that we did a MCQs. Okay. Thank you. But it doesn't mean that the MCQs will come in that only. But these are the previously asked MCQs.